Hi, I'm Kim Curry, and I'm a student physical therapist at Campbell University, and today I'm going to be talking about strain counterstrain, specifically anterior thoracic point 1. So before we get started, I'm just going to give a little background on strain counterstrain. Strain counterstrain is a passive positional technique that's aimed at relieving pain and muscle dysfunction. So the theory behind it is when you have muscle imbalances in your agonist and antagonist muscles, it can skyrocket, increasing the muscle spindle activity. So what we do in this technique is passively put our patients in a position of comfort, also shortening the muscles around that point, and it is thought, or the theory behind it is that it resets the muscle spindle activity to normal. So now I'm going to go over the steps we're going to take for finding the tender point and actually treating it. So the first part is going to be locating the tender point. This is crucial to our treatment plan because this is how every tender point has a specific position that we're going to treat them in. The tender point is going to be round, edematous, it's going to feel full and thick compared to the rest of the tissue, and it's really important to differentiate this from a trigger point, which is going to be found in the muscle and kind of cause a radiating pain. So the tender point is actually going to be 4 times more tender than normal tissue. The next thing we're going to do is find a position of comfort, which, like I said before, it's going to correlate to the tender point we find. The next thing we're going to do, once we're in that position of comfort with our patient, we're going to remove our finger from the point and just kind of monitor it. So we're not going to be adding pressure, but we want to monitor while we're in the position to make sure we find the mobile point, which is the maximal comfortable position for that patient. Once we're there in the position, we're going to hold for 90 seconds. This is really important because it gives the muscle time to passively shorten and reset that muscle spindle activity. Next, we're going to return the patient neutral to neutral slowly and passively, and this is very key because you don't want them actively moving themselves back. After this, we're going to recheck the tender point, and we're looking for 70% improvement in the pain at that point. The only contraindication to strain counterstrain is if the patient is unable to give feedback on how they feel or if they're not allowed to have any manual therapy whatsoever. So now that we've gone over the actual strain counterstrain technique in general, I'm going to talk about the specific point that I'm going to be finding today, which is the anterior thoracic point 1. To find this point, you want to have your patient supine. I'm going to raise the table some. And you're going to find the patient's sternal notch. So be sure you tell them what you're doing before you just start touching them in their anterior chest region. I'm going to be feeling for your sternal notch. So I come in here and I'm going to palpate inferiorly. So I'm not going to be pushing back, I'm going to be pushing down. And all I want is to push hard enough to blanch my fingernail. This should not be very painful for the patient at all unless this is a very tender point for them. So once you find that, and it's a tender point for them, you're going to get them up in the position to treat that. So now we're going to get you to sit up. And for this technique, for anterior thoracic point 1, your patient's going to be seated. The PT is going to be located posteriorly to the patient. And there are the manual actually states that the patient can put their hands on top of their head. But in class, Dr. Taylor has taught us a different way to do this. And as long as the same muscles are being passively shortened, you're going to get the same results from the technique. So better for the PT body mechanics and more comfortable for the patient. We're just going to have the patient relax there, and the PT is actually going to come around with their hand and place it on the patient's forehead. You're then going to instruct the patient. You want them to relax as much as possible, but sometimes it's better just to tell your patient to take a deep breath in and then take a deep breath out. And as they fall into their breath, you want the cervical flexion, and you also want upper thoracic flexion. So the PT is going to have to kind of move back and judge where the patient. While you're doing this, you should have your finger on the point of the sternal notch where the point is, because you want to monitor that tenderness. So while they're in this point, if you want to find the position of maximal comfort, you can actually adjust the head minimally to find the most comfortable position for them. Once you're here, you're going to hold this position for 90 seconds, and after that, you're going to move them passively back to neutral. So a way you can do that in this position is to bring their head up and actually come laterally and back to the middle so that that discourages them from actively contracting any of their muscles. So now that we've talked about the technique and talked about the patient and PT position, I'm just going to talk to my patient like I would and explain this how I would in a clinic. Hi, Kelsey.
Hi.
So you kind of explained to me that, you study a lot, you're kind of having poor posture, and you just kind of have this general pain.
Yeah.
So what can happen is sometimes your muscles can get really tight and just cause pain. So I'm going to check you first, and then I'm going to put you in a position, and it's really just going to be a very relaxing technique for you. And the theory behind it is just to hopefully relax those muscles.
Okay.
All right, so if you lay on your back first, I'm just going to be touching you around this area just to check to see if you're tender, okay?
Okay.
All right.
Yeah, it's a little tender.
So it is tender.
Yeah.
All right, so what I want you to do is sit up for me, facing that way. Good. All right, and I'm just going to come behind you. I'm actually going to put my hand on your forehead.
Okay.
And what I want you to do, I want you to take a deep breath in, and then I kind of want you to just fall into that breath. Good. Is that still a little tender?
Not as much.
Okay. For video purposes, I'm not going to hold this for the whole 90 seconds, but I would. Okay. So now we're going to get back up. Good. And now I want you to lay back down, and I'm going to recheck that point. So how is it now?
It's not tender anymore.
Okay. So since that point is less tender, I'm kind of hoping that reset your muscles and relax them a little bit and decrease your pain level. But I'm still going to check some of the other points along your anterior side and maybe even your posterior and see if we can relax your whole body up there, okay? So 2 good resources for strain counterstrain are Wong and Cousineau's, which I will post at the end of the video, but these are really good resources for looking at the concepts behind strain counterstrain and also clinical evidence for it. One thing just to remember with strain counterstrain is that we're not treating a specific muscle or specific part of the body. These tender points are sensory manifestations of a musculoskeletal or neuromuscular dysfunction, and it's really important to take a holistic approach with our patients.